This was a 74-year-old woman who had Alzheimer's, and early on in the disease, she was saying she would want to die before going into a care home, and they administered the initial drug in her coffee. She didn't die. She sat up and tried to pull away from the administering of a second drug, and they held her down and forcibly killed her.
The doctor who did that was not convicted of any crime. If somebody were to quote unquote wake up in that circumstance is clearly struggling, why would the presumption be to kill them? We have this new situation, maybe evaluate it, discern what it is they want now. That wasn't at all the reaction. The reaction was, hey, it's time for them to die right now. There's some data to show that physicians rate the quality of life of their patients 2 points on a 10-point scale less than the patients themselves.
Wow.
We put these individuals essentially in care homes where they're desperately lonely. Sometimes they put them in chemical straitjackets, which is essentially giving them antipsychotic drugs when they have no psychosis, but because it keeps them docile, it doubles their chance of death, and they do it anyway. But Lila, in 20 years, the number of people with dementia is going to double. In 30 years, if nothing is done, it's going to triple. I'm as pro-life as they come, as you know, but even I would look at the situation and say, well, what are my options here, right? I can waste away in this terrible place, or I could choose this. It's wrong, but I can understand why someone would be tempted to have physician-assisted suicide. But that is the very definition of coercion, not a free choice. That is a horrific coercion of people who are incredibly vulnerable. Once you say healthcare providers can kill their patients, you've lost any coherent sense of what healthcare actually is. If you get it your way, it's fast food. There's no professional understanding of what this even is anymore. Customer's always right. This dementia crisis is something we have to respond to. We're already in deep trouble, but we're going to be in really deep trouble if we don't find an answer to it.